Oral presentation 8, seizure patterns, preconception care and pregnancy outcomes in women with epilepsy in a tertiary care hospital. The authors are Dr. T.S. Palihavadana, Dr. C. Jayasinghe, Dr. U.K. Ranawaka. The presenting author today is Dr. M.B.C. Mota.
Good afternoon. Let me share with you our study on seizure patterns, preconception care, and pregnancy outcomes in women with epilepsy in a tertiary care hospital. Epilepsy is a relatively common neurological problem that affects 3 to 4 per thousand pregnancies. However, data on epilepsy in pregnancy is limited in the South Asian region. Our aim was to describe preconception care, seizure patterns, and pregnancy outcomes in women with epilepsy attending a Sri Lankan tertiary care hospital. All pregnant women with epilepsy admitted for delivery to the University Obstetric Unit at the Colombo North Teaching Hospital during a 3-year period were recruited for the study. Women with a history of epilepsy confirmed by clinical records were included. Data were collected by a single physician using a structured research questionnaire following informed written consent. Data on preconception care and seizure pattern was obtained via direct questioning and medical and obstetric records. For fetal assessment, a single pediatrician examined all neonates for predetermined dysmorphic features, cleft lip, cleft palate, and hypospadia. Prior to discharge, all neonates underwent a 2D echo and ultrasound abdomen. Ethical approval was obtained from the Ethics Review Committee of the Faculty of Medicine, Calenium. The results. Out of 9,520 pregnant women during this period that was screened, 63 had a history of epilepsy, giving rise to a prevalence of epilepsy of 6.6 per thousand pregnant women. The mean age of our women was 28.7 years, and up to 90% of them had some form of secondary education. The seizure type is given here. Nearly 3/4 had generalized epilepsy, nearly 1/4 focal, and the rest, the type of epilepsy could not be clearly identified and they were grouped as unclassified. And the pie chart here gives a more detailed breakdown on the type of epilepsy. With regard to preconception care, out of the 63 women, 53.9 received some form of preconception counseling prior to embarking on their pregnancy. Out of the women who were on antiepileptic drugs prior to conception, only 42.7% of women received the recommended dose of folic acid, which was 5 mg. 50% did not receive the recommended dose, and 5.2% of women were unaware whether they were on the recommended dose or not during the periconception period. When we looked at the seizure pattern, in the preceding 2 years prior to the pregnancy, 42.9% did not have any seizures. 57.1% did have seizures, and 28.6%, more than a quarter, had one or more seizures over the last 6 months, the 6 months prior to their pregnancy. When we looked at the seizure occurrence in their current pregnancy, more than half, 55%, had seizures either during pregnancy or in the 3 months following the pregnancy. And the table below gives a more detailed breakdown showing the seizure occurrence according to the trimester and up to 3 months postpartum. And as you can see, it is during the 3rd trimester that the occurrence of seizures is highest, followed by the 3 months postpartum, the 2nd trimester, and then the 1st trimester. When we did a small analysis to look at the cause for seizures in pregnancy, unsatisfactory drug compliance accounted for 8.4%, sleep deprivation in 2.8%, but in the majority of women, the cause could not be identified. When we looked at the anti-epileptic drug use in pregnancy, at the time of conception, 71.6% of women were on one drug only, more than a quarter were on two drugs, and none were on more than two drugs. When we looked at the modification of their medication during pregnancy, 6 women had one drug being added, 1 woman had 2 drugs being added. There was a change of their medication in 17 women, and 25 women had no change in their drug regimen during the course of their pregnancy. Now, the all-important pregnancy outcome. 61 live births occurred, 1 stillbirth and 1 neonatal death. 66.7% ended in normal deliveries. Cesarean section accounted for 33.3%. Hypertensive disorders, which is a known association with epilepsy, was seen in 22% of women, with pregnancy-induced hypertension in 6%, preeclampsia 14%, and eclampsia 2%. When we looked at the fetal outcomes, prematurity was seen in 9.5%, low birth weight in 42.8%, and major congenital malformations in 11.1%. And the breakdown of congenital malformations is given here: cleft palate in 1, cardiac anomalies in 6, ASD 4, ventricular septal defect 1, and a patent foramen ovale in 1. And the other congenital malformations that we look for are listed below, but were not seen in any babies. And we looked at the seizure patterns in pregnancy and the anti-epileptic drug use at conception in the mothers of babies with congenital malformations. And all except 2 women had seizures in pregnancy. And all women were on anti-epileptic drugs at conception, 5 of them on polytherapy. This led us to look at the probable association between seizures in pregnancy and firstly seizures in pregnancy and the occurrence of major congenital malformations. And what we found was that seizures during pregnancy gave rise to odds ratio of 2.17 for the occurrence of major congenital malformations. However, this association was not significant. Secondly, we looked at the use of anti-epileptic drugs during conception and major congenital malformations. This gave us odds ratio of 12.14, and it was not significant. However, the use of polytherapy at the time of conception versus monotherapy or no therapy gave rise to odds ratio of 20.83 for the occurrence of major congenital malformations in our women, and this association was significant. To conclude, our study showed that preconception folic acid coverage and counseling was inadequate. The majority of women had experienced seizures during the preceding 2 years prior to the current pregnancy. Seizures occurred in more than half of women during pregnancy and were more in the 3rd trimester and postpartum. Hypertensive disorders, major congenital malformations, and low birth weight were high in our population. Cesarean deliveries and premature rates were not high. Anti-epileptic drug polytherapy at the time of conception was significantly associated with a higher risk of major congenital malformations compared to mono or no therapy. And therefore, I would like to conclude by saying that our data adds to the limited body of data available on women with epilepsy in Sri Lanka. So far, we have only one study done in Sri Lanka with regard to women with epilepsy, and therefore we can say that our study data is the first to reveal information on preconception care and seizure patterns in Sri Lankan pregnant women. Thank you.
Now it's Q&A.
Your findings, are they comparable to the previous studies that had been conducted, or are there?
Yes, madam. So with regard to the results, if you look at the I told you there was one study conducted in Sri Lanka, and it was published 2 years ago. They looked at the major congenital malformations. It was 9 point something. It was 9%. So ours was 7.1%. But they looked at the seizure frequency in pregnancy, and they found that 64% of women did not develop seizures in pregnancy, whereas we found that 45% of women did not develop. So we found a higher incidence of seizures in pregnancy. When we looked at the international data, it was somewhat comparable, except for our low birth weight rates, which were higher than the international data. The highest incidence was 38%, whereas ours was 42%.
Birth weight.
The low birth weight. So that was the only thing that was not comparable, but the rest of the data appeared to be comparable to international data.
Other than the number of drugs, whether it's monotherapy or polytherapy, did you check individual drugs, whether one particular drug is more associated with congenital malformations than the other?
Individual drugs.
Yes.
We did not analyze that. No.
Don't you think that it would be important?
That would be important, but because our sample size was small, we were wondering whether that would, whether it would be powered, whether our study would be powerful enough to look at that association. We were thinking that we need
I think the main problem is your sample is pretty small.
Yes, sir.
So when you compare it to the studies you quoted, what were their samples?
The study that was done in Sri Lanka, the sample size was 9 to 6. And the international studies, of course, they were kind of registries where they had thousands, like 20, 30,000. So they were mainly registries, like the Europe study. So I think in the large studies to look at the individual drugs and their effects, I think our study was not enough to look at
with
that.
With regard to folic acid,
yes.
What's the recommendation there?
The dose,
is it necessary for all drugs?
Most of the anti-epileptic drugs, at least the older generation drugs, they exert the therapeutic effects to anticoagulate effects. But the newer drugs like lamotrigine, they are much more safe. Thank you.